training video for a non-surgical thread lift using 8 of the Mint 43 centimeter threads. They're U-shaped, so it actually looks more like 16 threads. That's why there's 8 marks for exits on each side of the face. You put in tumescent local anesthesia using 50 cc's of 0.5% lidocaine with 1 to 200,000 epinephrine. You start with the 30 gauge needles in the temporal hair, then you move on to the 25 gauge 1.5" needles, and you have to inch your way along to make sure you get the entire length of where you're going to pass these threads. And you better make sure you give extra at these exits and go a little more superficial there, because that's the part that they feel it the most and it's likely to bleed. You prep the face, you drape, and anywhere it's not white, you give a little more local, and then you make these two 1.5 millimeter punch incisions about 1.5 centimeters apart. You put the temporal passer and you then thread 2 threads through the temporal passer just 1 inch, and you pull back the temporal passer. Now you have the threads. You repeat this process because you want to make sure there's 4 threads on each side, where you thread the needle again just a tiny bit, pull the temporal passer back. Do not go deep with the temporal passer. It is easy to catch the fascia in this area. And then you go a non-painless passing with the blunt passer. You pull back on the blunt passer and it's sharp at the end, and the sharp allows it to poke through the skin. And then you pull out the blunt cannula, and then you thread the sharp cannula. You pull the sharp cannula out from below. You always go rather deep so you're on top of the SMAS, and you want to make sure you're not just beneath the skin, because these will leave a little dimpling. And you always want to cross the top one because it gets too close to the eye if you don't. Always push back a lot when you're cutting these after you pull the threads as tight as you can get them. You repeat the process on the other side. There's, once again, 4 threads on here, which looks like 8 threads since they're U-shaped. I always cross the top one because otherwise it'll be too close to the corner of the eye. And then when you're done, you wipe it off, release any dimples. This is how she looks just 4 days later.